How are you all? I hope you all are doing very good. Today I am back with our another video on your channel Dentistry Life. Today we are going to discuss about the high yield points or important points. Question may arise on these points in your NEET exam. Firstly, the question that is expected to arise, that is on the basis of the stages of the AIDS. There are three stages of the AIDS: the stage 1, 2 and 3. First stage, in this stage the CD4 count is greater than 500. In stage 2 the CD4 count is in between 200 to 499, and in case of stage 3 the CD4 count is less than 200. This is important. You have to memorize or write in your notebook about the stages of the AIDS. Next, the WHO classification, the primary HIV infection. Next, four stages are there: clinical stage 1, clinical stage 2, clinical stage 3 and clinical stage 4. Next, according to CDC, the stage 1, 2 and 3. Stage 1, that is acute HIV infection. The infection is very acute in this stage. In case of stage 2, the infection is clinical latency. And in case of stage 3, the infection is high, or this stage is known as AIDS, acquired immunodeficiency syndrome. This is the important point. Note all these important points in your notebook. Next, now the important one is ectodermal dysplasia. What are the features that you will see in ectodermal dysplasia? It shows supernumerary syndrome, teeth, anodontia, oligodontia, conical teeth, slow hair, gland growth, lack of sweat glands, concave nasal bridge, patients that are most commonly seen in older age group. Ectodermal dysplasia, what are the important features of ectodermal dysplasia? You have to know, and the question arise on the features of ectodermal dysplasia. Next, the important question: what is the key factor for the denture to be successful? For a good denture, the what is the most important factor that you need to know? The most important factor that you need to know is the stability. Next question: a child is a 5.4-year-old child. How much fluoride supplement should be given to that child in this age? It is around 0.25 to 0.28 ppm. This much amount of fluoride is given in a child of a 5 years old. Next question: infection stage of syphilis. The infectious stage of syphilis, that is your secondary stage, is the infectious stage of syphilis. Next question: optimum temperature treatment for palatal papillary hyperplasia. In case of palatal papillary hyperplasia, what is the choice of the treatment? That is electrosurgery. Three canals. In which tooth we can see three canals? Three canals are most commonly seen in the tooth, that is maxillary first molar. Triangular central incisor. Why is triangular central incisor? Why the shape of the access cavity preparation of a central incisor is triangular? For straight line access, for the good accessibility. If this is not in option, for straight line access is not in option, then you have to mark then exposed to pulp horn must be exposed. तो आपको ये option mark करना है. Angle class 2, chances of trauma in case of class 2. Which class has higher chances of trauma? It should be class 2 div 1, class 2 div 2, which the class 2 division 1 has higher chances of trauma. Most broad spectrum antibiotic. Most commonly used broad spectrum antibiotics, that is tetracycline and chlorophenicol. Angioedema is by which drug? That is ACE inhibitor. Dense indenti. Where dense indenti is most commonly seen? That is most commonly seen in lateral incisor. Look like. How does it look like? It look like a cingulum on X-ray. One question on slope rule. What is slope rule? That is same side lingual, opposite side buccal. Image based question or the simple question on slope rule may arise. Most difficult to floss. Which tooth is most difficult to floss? That is mesial aspect of maxillary first premolar. Mesial aspect of maxillary a premolar first is most difficult tooth to floss. Now, dental clicking. Now, dental clicking. Why dental clicking arise? Dental clicking arise due to increased vertical dimension of occlusion. Next, function of rest. In case of RPD, what is the function of rest? Rest mainly provides vertical support. Now, this is the end of your video. These are the most important questions that may be expected to arise in your exam. You may note all the questions, and I'm sure I am back with another video and we will discuss more questions. Stay tuned to our channel. If you have not subscribed, subscribe to our channel. Thank you very much.